Side effects of smoking marijuana can be segregated into acute side effects that happen at the time of use and chronic ones, dizziness, nausea and vomiting, vivid dreaming, etc. There's long been a recognition that chronic marijuana users may develop some mild cognitive changes when you do formal testing. And so that's always a concern, and I want to bring this up because when I discuss the pros and cons of this with a patient in the clinic with the door closed, I want them to know that there's the possibility it may help their symptoms, but there's also there are negative effects that they need to take into consideration. It's an individual decision that I'm not making. I'm there to provide information to the patient so that they can make an informed decision about whether this is something they want to pursue or not. Well, so this all really has come to the fore in our state because of the ballot initiative in 2008. So the Michigan Medical Marijuana Program was established on the heels of the approval by voters in the state to allow marijuana use for medical purposes. So they created this program to administer a registration process. So to become a registered user, you are obliged to go through this process. You have to be a resident of the state of Michigan, and there are other requirements that are important to fulfill that I'll talk about in a minute. It's administered by the state, the Department of Licensing and Regulatory Affairs. This office reviews applications patients or caregivers send in. It issues registration cards, and it maintains confidential records and statistics. And it's the main official source of information on the Michigan Medical Marijuana Act of 2008. So I know you can't read this, but this is just a screenshot of the website. So this is from michigan.gov. Okay, it's the Licensing and Regulatory Affairs. So if you want to look this up on your computer, michigan.gov, and you can type in MMMA or MMMP, and it should eventually get you to this page. Okay? And again, I know you can't read it, but there's lots of information here. This is the source where you would go to get the official state-approved forms to register for the program. So you can download the forms onto your computer. They're PDF files. Fill them out. And it requires the authorization of a licensed physician. So an MD or a DO has to sign the physician form, and that's shown here. Again, I know you can't read it. Don't worry about the details. This is just what the form looks like. It's a 5-page form. This is the instructions. This is the part that we as physicians see. So I'm required to put my name here. I'm required to put my Michigan medical license number right here. I'm required to sign the form down here. And I'm required to certify that the patient I'm signing this form for has a medical condition for which this is approved. So this is not approved for all types of medical or neurological disease. There are categories of disease, but again, you can't read it. This is the box that we check here for MS patients. So MS is an approved indication for the use of marijuana for medical purposes. So again, I fill out this part here. I check this box. I put your name, your date of birth here, any comments I want to make here. I sign the form and I date it, and that gets sent in along with the other 4 pages of the form where you're required to put your demographic information. There's a registration fee of $100. The state processes the forms, and they send you a registration card. So just for some frame of reference, some statistical frame of reference, it turns out since this program started accepting applications in early 2009, there have been almost 150,000 applications. Okay, and more than 80,000 of them have led to approval and issuance of a registration card. Sometimes the applications are denied. Usually it's because the applicant hasn't fully provided all the information that's required, so they're quite strict about filling out everything on the form. They'll send it back to you as an incomplete form if it's not handled appropriately. And there's a small office somewhere in Lansing that processes all the paperwork here. They're backlogged. So the website will tell you that things that were received in February are being processed now. So people are going through all the information. So it takes some time for the registration to be approved and your card to be issued. Now, what I wanted to know, and what the website doesn't tell you yet, is some other information. For example, how many people are qualifying under the different disease categories? So how many of these are MS patients versus cancer patients, for example? How many providers in the state have been approving these? Is it a small group of individuals? Is it being done widespread? So they claim to be collecting statistical data here, but nothing available yet. So what the state doesn't do is provide you with marijuana. It just provides you with the authorization in the form of an official registration to be a certified user. And now there are controversial sites where you can go that are marijuana dispensaries. You can show your registration card, and it allows individuals to get access to marijuana for medical purposes. You actually can also be approved to grow your own marijuana plants if you want to undertake that. Don't ask me. I don't have the foggiest idea how to do it. Patients ask me, what do I do next? And I don't know. But there are places in your community, I would bet, that you can get access to marijuana in a non-clandestine, on the street corner kind of way. So there are dispensaries where you can go, and the official cards are honored, and it's a cash purchase. Your insurance isn't going to cover this, so and they don't give you any advice about how much to take or how often to take it or anything like that. Don't ask me, I don't know either. So, but it is available, and I wanted you to appreciate that there is a process here. So I got to wrap up from a time standpoint. So, CCSVI is still a very hot button issue. It's really unclear to us the extent to which it occurs in MS patients. I personally feel very strongly that people should not undergo invasive procedures, angioplasty procedures, or stent placements unless they're enrolled in a careful, well-designed study. Okay? So if you want to help the field, go somewhere that's doing a study on this. But don't go somewhere and just have the procedure done because you think it's going to work, because we just simply don't know yet, and there are risks. So marijuana can be used to treat a variety of MS-related symptoms, and the use in this context, again, I would strongly encourage people to go through the Michigan Medical Marijuana Program to get certified and registered.